Spring is in the air. Can you hear the birds singing? Perfect day for a dog walk, and I'm sure Lulu is not going to disagree with you either. But this is not a perfect day for me because I'm a hay fever sufferer, and you can probably tell in my voice and my sniffles that I definitely am. And unfortunately, on a day like today, when it's very dry and humid and also slightly windy, the pollen count is very high. So I've probably come to the worst place because as hay fever sufferers, we're told to avoid high pollen days, try and stay indoors on those days, and lots of other useful advice. But I don't think Lulu will appreciate me staying indoors and not giving her walk. So watch this video all the way through to the end so you can find out what hay fever actually is, what makes it worse, what we can do to help. And don't forget to hit that subscribe button so you don't miss out on any of our weekly videos. Now, I'm not alone because approximately a quarter of all hay fever sufferers in the UK are allergic to tree pollen. That's all around me at the moment. Are you a hay fever sufferer? Maybe you are. It'd be interesting to hear what you do to help. So leave a comment below, please. Now, tree pollen allergies are seasonal and they mainly occur between February and June. But it could be as early maybe as January, as some shrubs and trees start releasing that pollen quite early on. And because it's triggered quite early on in the new year, people often confuse these symptoms for the common cold, or dread I said the word COVID. So let's have a look what actually hay fever is and what are the common symptoms. Now, hay fever is a type of allergy, and it's normally a seasonal allergy, and it occurs when the body reacts to pollen from trees or shrubs as though it's some kind of harmful substance. And to fight this supposedly harmful substance, a hay fever sufferer's immune system will start producing antibodies to try to prevent it from spreading. Now, these antibodies, the histamine that's produced by the body, leads to the sufferer developing typical hay fever type symptoms, such as probably what I've got right now, sneezing. I just had a big sneezing fit before I started filming this. Nasal congestion, watery and running nose, an itchy nose, and maybe really watery eyes as well. Other symptoms can also include earache, headaches because it's all blocked up there, a reduced sense of smell, itchy eyes, sometimes disrupted sleep because you can't sleep because you can't breathe properly, tiredness, irritability. Yeah, I do suffer for all those. But also those are common symptoms for colds and also, dare I say that word again, COVID. But hay fever can also increase asthma symptoms or the risk of an asthma attack in asthma sufferers. If you want to learn more about asthma, just click the link you'll see up here about our asthma video, and I'll leave a link below for you as well. If you're asthmatic and have a pollen allergy, be sure to have your asthma medication with you at all times. And it's vital to take hay fever medication as well. The medication can be like nasal steroids, antihistamines, anti-inflammatory eye drops, because research has shown that asthma sufferers who also have hay fever can significantly reduce the risk of going to A&E if they treat their hay fever effectively. So let's have a look at then how you can treat a pollen allergy. So what kind of things I would do as a hay fever sufferer? Because the best treatment really is not to come into the woods, not to come into anywhere where there's going to be pollen, but it is extremely difficult to avoid, especially in these lovely spring and summer months when I want to walk my dog. But we could try and reduce our exposure to it by staying indoors maybe on dry, windy days. Maybe we can ask my neighbours or others to help gardening during these peak pollen seasons if you're lucky enough to have a garden. Keep doors and windows closed when you know the pollen counts are due to be really high, and normally the weather alerts do tell you when the pollen counts are going to be high. And then you can also, of course, try some medication. Now, I do take medication. I take my antihistamines every day, and I also take a steroid nasal spray that really helps me. But as I said before, like asthma sufferers might also take eye drops, and you can as well. Thankfully, my eyes don't get affected just yet. But maybe go and speak to your chemist or make an appointment to see your doctor to see if you can get any medication that's going to help relieve your hay fever symptoms. At night time, I also do a big steam as well to clear my airways, so it helps me be able to sleep, because I really do suffer not being able to sleep at night time. So clearing my airways, and also some like sea salt spray you might also want to try as well. So people are saying hay fever is worse this year. Is that possible? Well, it kind of is. I think it's worse this year, but that's probably just because I always think every time I'm ill, it's worse than last time. But it could be worse because we have spent 2 years, the past 2 years, maybe in lockdown at various different stages. We've also been wearing face masks as well. So maybe our immune system is slightly weakened due to that. So when we've taken our face masks off and we come to the local park, we're more exposed to pollen than we have been previously. So we could have a weakened immune system due to that. But also, climate change is making pollen stay in the air a little bit longer as well. So it could be worse this year. Thanks for listening, and don't forget, if you're interested to learn more about asthma, you can click the video link above, or you can go and look at the link I've left below for you.